This is Bill Wethington with Wethington Insurance Senior Benefits, and today we're working forward in our series of videos that we call Medicare Primer that are designed to give you the fundamental basic knowledge about Medicare that you need to make informed decisions, informed choices about your Medicare. In previous videos, we talked about original Medicare and what that is, that when you say you have Medicare, you enrolled in Part A and Part B, you have original Medicare. And from there, you have two choices, two paths that are available to you. And one is the path of keeping original Medicare and adding a Medicare supplement insurance plan. And we talked about that in a previous video that you may want to review at this point. Today, we're going to talk about the second choice, option 2, which involves what is called a Medicare Advantage plan. Medicare Advantage plans have been around for some time, but they've really become popular in the past few years, and we believe it's something you really should look at when you're making your choices. Medicare has contracted with private insurance companies that they approve to provide the services that are equal or better than the services of original Medicare through these private insurance companies. And the way Medicare Advantage covers your Medicare medical bills is quite different than it would be under original Medicare with a supplement. Medicare Advantage plans are called kind of pay-as-you-go plans. Many of these plans have zero premium. And one of the frequent questions we get is, how can you do a plan without a premium? But you see, in reality, behind the scenes, Medicare has contracted with these carriers, and they are paying them a fixed amount every year to provide these benefits. So they're getting adequate funding. You continue to pay your Part B premium of $140.60 in 2020 when we're recording this video. Regardless of which route you go, you're always going to pay that premium of $140.60. But many of the Medicare Advantage plans have no additional premium, which is an attractive feature compared to a supplement policy that you pay a premium for. Zero premium, however, doesn't mean zero cost. The way these plans are designed is that every time you use a service, you will pay either a deductible, a flat fee, or coinsurance. As those fees begin to mount up over the year, there is a maximum out-of-pocket limit. So you see, that's quite different than original Medicare. One of the issues in original Medicare is that there's no limit to that maximum out-of-pocket. But in the Medicare Advantage plans, they do put that limit there, and Medicare sets the most that an insurance company can charge you for maximum out-of-pocket cost at $6,700. However, many companies offer a lower out-of-pocket amount than that. The average is probably around $5,000 maximum out-of-pocket. So just to give you an idea of how that works, and understand that the various companies that offer Medicare Advantage plans are all different. In the Medicare supplement world, the plans, remember, are all standardized. If you're looking at one plan with two different companies, they're exactly the same coverage. That is not the case with Medicare Advantage, so it becomes a little more complicated to evaluate. They cover pretty much the same things, but how they do it can be quite different. So I'm going to just kind of go through a few examples of a typical Medicare Advantage plan. For example, let's say you have a primary doctor that you go to, and they call that your primary care physician. You might pay a $10 copay whenever you go to the doctor. If you go to a specialist, that might range between $25 to $35. And then if that specialist wants to draw blood work, or they need to do a particular test or get an MRI or a CT scan, all of those different procedures have a set cost that's determined every year by the insurance company that they're going to charge. So that doctor's visit, the cost to you would depend on what the doctor did while you were there. So you pay those things out of pocket. For example, if you're hospitalized, every company is going to charge you a per day charge for hospitalization. And that could range from $275, say, to $350 a day, depending on the scheduled benefits of that particular company. And generally speaking, they will charge that daily fee for up to 5 days or maybe 7 days. So they vary on those kinds of things. The coverage that a Medicare Advantage provides, when you look at it from a big picture point of view, is very comparable to what you would get in original Medicare. Again, unlike original Medicare though, you pay as you go, and then each year you add those up. You know, as you work through there, you might have a year if you're healthy and maybe you see a doctor 2 times and you're out $20. Or you could have a year where something really serious happens. Eventually those things happen, and you might be out $5,000 or maybe as much as $6,700. So it's a little difficult to budget other than budgeting and knowing what your maximum out-of-pocket is. One of the attractive features, though, is the fact that these are zero premium plans, and then what you actually end up paying will vary depending on what your particular needs are that year and the plan that you chose. One of the things that you need to be aware of with the Medicare Advantage plan is that unlike original Medicare, Advantage plans have networks. So your care has to be within the network that that particular plan has. And those 2 types of networks, an HMO plan or a PPO plan. HMO is a health maintenance organization, and those are typically more of a local, tight type of network, so that you would be, in most cases, restricted to, you know, your local area. Some of them have a regional approach. But for example, if you wanted to go to Texas for a specialist there because you had cancer and you wanted to go to MD Anderson facility in Texas, if that were out of network, and it probably would be for an HMO plan, you would pay 100% of that cost out of pocket. It would not cover that at all. The HMO networks cover out of network only for accidental or emergency type situations. The other alternative, and sometimes the same company will offer both options for you, an HMO or a PPO. The PPO plans have a broader network. Some of them have a national network, so that you can go to somewhere like the MD Anderson or to Mayo Clinic or the Cleveland Clinic. So that's one of the things to really consider in an Advantage plan. For example, if you want that, if that's something that's important to you, to have not very many limits on your options, then a PPO plan might be right for you. Particularly so if, let's say, you're a snowbird and you go to Florida during the winter, or to other warm places, Arizona, Alabama, those kinds of places, and you're out of the area for several months, you would want a plan that, if you needed care, could take care of you in the area where you're staying. So the networks are a big factor in choosing the right Medicare Advantage plan. Another feature of the Medicare Advantage plan is it's a bundled approach to the coverage, because many of these plans will offer you original Medicare packaged inside their plan, so that's Part A and Part B, and then they also will add your prescription drug coverage, Part D, and all of those are part of the Medicare Advantage plan that's called Part C. I hate to confuse you with all those parts, but a Medicare Advantage plan would include Part A, Part B, and Part D, and they call that Medicare Advantage, which is Part C. You know, it couldn't be more confusing, I think, in the way they chose those letters. But that can be an advantage as well, that instead of having original Medicare and a Medicare supplement plan and a prescription drug plan, now you've got everything under one umbrella with one company, and many times with zero premium. Now, some plans will require a premium, but some of them are available at zero premium. And your maximum out-of-pocket cost is set by the plan, but that does not include the cost for the prescription drug plans. They're always separate. Another feature of Medicare Advantage plans is, they add, and particularly in recent years, they've become very popular because there's been additional coverages that aren't traditionally covered by Medicare at all. Things like basic dental services. Now, to get a comprehensive dental plan, you have to pay an additional premium, but some of the plans include automatically basic dental care like x-rays and cleanings a couple times a year. They also will include some vision coverage, some of them will, and some hearing coverage. So those are things that you should look at and see if they are something that you need or you would want to be included in your Medicare. They also have things like transportation, over-the-counter expenses. If you get, like Sudafed or something like that that's over-the-counter, they give you allowances to purchase those things. Generally, they will include a gym membership and just different services that different plans will build into that kind of add to your benefits. Another thing that's popular with Medicare Advantage plans is they take a total health approach. And when you enroll in a plan, they will have a health professional dedicated to your care. They will call you and do an initial wellness assessment. They're available to help you to schedule appointments and to find care if you're having trouble finding someone in the network. So there's a person there that you can call and help you manage your care. Now, each year with a Medicare Advantage plan, you get a summary of benefits. And it's a booklet that can be quite complicated. Generally speaking, they're going to be 75 to 85 pages long. And in that booklet, in great detail, they explain the cost to you of each of these services that we talked about. They'll explain to you the network. They'll explain the prescription drug plan. And they'll explain all the other additional benefits that are part of a Medicare Advantage plan. As I said, these plans are becoming very attractive, and in recent years we're seeing more and more people who decide to go into the Medicare Advantage plan. They can be a very attractive option. We, as an independent agency, we represent all the major carriers offering Medicare Advantage plans, so we can go over those with you and determine, based on your situation, the plan that might best fit your situation. So 2 choices, both really good choices, and it's just a matter of picking the one that meets your situation best.